Let's talk about necrosis. How does a necrosis occur? So we have studied about the reversible and irreversible injury. Whenever we have irreversible injury, this irreversible injury invariably will lead to necrosis. Why not apoptosis? Because apoptosis has a definite programming. Okay, so that is why these will invariably lead to necrosis. After this, we will be studying the difference between apoptosis and necrosis, and you'll be more clear if you have understood the necrosis here. Okay, so if you're talking about necrosis, basically once your cell membranes get lysed, okay, once your cell membranes get lysed in irreversible injury, the cell is invariably going to undergo necrosis. Okay, so all of you know what happens when the membrane gets lysed. All the calcium from outside is coming into the cell. All the calcium from the cell is coming into the cell, and the most important function in necrosis, and this pathway we have already studied in irreversible injury. So when the calcium is coming into the cell, the mitochondria forms large amorphous densities. Okay, and we have talked about this mechanism also earlier. So the two characteristic features of necrosis or irreversibility is once your membranes are damaged, and once you get profound mitochondrial damage, okay, dysfunction. So once you get membrane damage and the second profound mitochondrial dysfunction, when it occurs, you're definitely going to get necrosis, because these are the features of irreversibility. This is the feature of irreversibility. So once you get membrane damage and profound mitochondrial dysfunction, so once you have large amorphous densities in the mitochondria, that's it. Okay, that means this is irreversibility. Okay, so that is profound mitochondrial irreversibility, and this is what characterizes irreversibility and will progress into necrosis. Okay, so there is no programming in necrosis. So that is why there are types of necrosis which you should know. Okay, so the types of necrosis are the most important thing. So whenever the cell dies, the most common cause of necrosis, if somebody is asking what is most common type, it is always coagulative necrosis. So coagulative necrosis occurs because of denaturation of the proteins. Okay, so because the proteins get denatured. Okay, so not only the proteins get denatured, enzymes also get denatured. Okay, so when the enzymes get denatured, that is why the cell outlines remain preserved for a longer period of time. Okay, so your membranes are denatured, however your membranes appear intact. Microscopically they appear intact. So what happens? Because they appear intact, you can identify the organ. So you can identify which organ has been killed. Why I'm telling you this is because the opposite of coagulative necrosis is liquefactive necrosis. So all the organs of the body undergo coagulative necrosis except brain, which undergoes liquefactive necrosis. So here there is enzymatic action. So enzymatic degradation is extensive here. So because enzymatic degradation occurs, whole of the membranes are lysed. And complete tissue is replaced into pus. Okay, complete tissue is replaced into pus. So there is marked dissolution of the tissues. So there is pus formation which occurs here. So that is very, very important that we have to be clear. Okay, so whenever I'm talking about necrosis, okay, so remember we have coagulative necrosis, which is most common, and then we have liquefactive necrosis, which is seen in brain. And we have seen that denaturation of the proteins typically is a mechanism of coagulative necrosis. Enzymatic degradation is a mechanism in liquefactive necrosis. You've seen whenever there is an enzymatic action, it causes dissolution of the tissue and it's forming pus. Whereas in coagulative necrosis, the membranes appear intact. So you can identify the organ. Okay, only after this. Okay, so also there is a very characteristic another appearance which is seen in coagulative necrosis is that the tissues appear very glassy. Okay, so why does the tissue appear glassy? Because there's loss of glycogen. Okay, so we have already started about it, that in irreversible injury the glycogen is consumed. So this is because of loss of glycogen. So this will make the tissue appear very glassy. Only after the tissues are dissoluted, okay, so there is dissolution of protein, there is breakage of the DNA of the nucleus. Okay, so what happens is, after a point of time, what happens is that cell starts appearing very pink in color. So why does the cell appear very pink? Because you've already studied when the membranes are lysed. Okay, after a point of time, when the calcium comes in, it activates the endonucleases. Endonucleases is going to break the nucleus in 3 types. One is pycnosis, second is karyorrhexis, and the third is karyolysis. So the nucleus completely dissolutes. Okay, nucleus completely dissolutes. Okay, so if you look at the cell, so here first change that occurs is pycnosis. Okay, so when we talk about this, so here you see there is pycnosis. Then we have karyorrhexis, that is fragmentation of the nucleus, and then there is lysis, karyolysis. So one, the nucleus is completely lost. Obviously the nucleus gives blue color to the cell, so the blue color is lost. Not only that, you know, there are activation of RNAs also. So because of RNases, the cytoplasmic RNA is also eaten up. Okay, so the cytoplasmic RNA is also eaten up. So loss of cytoplasmic RNA is also seen. So because the cytoplasmic blue color, जो थोड़ा सा भी blue था, वो भी loss हो गया, and the nucleus is also now lost its blue color. Because of these things, the cell appears very, very pink. So if somebody says, why does the cell appear very pink? It is loss of the nucleus, number one. Number two, loss of the cytoplasmic RNA. Okay, because RNAs are also activated here. So that is why the cell appears very, very pink. Now, after a point of time, what will happen is the lysosomes will get activated and they will completely eat the cell. So this cell is called as moth-eaten appearance. What is this appearance called as? Moth-eaten appearance. So that is the terms that they give you for necrosis. That is why you have to remember necrotic cells are very glassy because of loss of glycogen. They are very pink because there is loss of cytoplasmic RNA and the nucleus. And they show you moth-eaten appearance when the lysosomes get activated and they digest the cell. So these are the terms which you should be clear. So when we're talking about most common necrosis, it's coagulative necrosis. All the organs show coagulative necrosis except the brain, which shows liquefactive necrosis. The main mechanism of coagulative necrosis is denaturation of the proteins. Okay, and because enzymes are also denatured here. Enzymes are also proteins, so they get denatured. So therefore, membrane appear intact for a long period of time. So you can identify the cell. After a time, cells also appear very glassy because there's loss of glycogen, and also cells appear very pink because there is loss of DNA and RNA. Apart from that, you have to remember that there is also the cells, after a point of time, they appear moth-eaten when the lysosomes start digesting the cell. Whereas in liquefactive necrosis, the enzymatic degradation is the main mechanism. So it completely dissolutes the tissue and the brain is completely turned, there's a complete dissolution of the tissue and you can see brain as a pus or there is a vacant space which is there in the brain. So this is very, very important in the post-mortem. So that is why they always inject formalin in the brain. Okay, especially in the children when they die, so that brain gets fixed. If you don't do that, the enzymes will dissolute the brain into pus. That is the first thing that you should do when you have to do the autopsy and you have to examine the brain, especially in children. Inject the formalin in the brain. So these are two common type of necrosis. First, we have to understand. Okay. So now once we are clear with this, let's look at them. So look at this. So this is the kidney. You can identify this is a glomerulus. And what catches your eye? That is, there is no blue color. It's completely pink. There is no blue color. There is no nucleus in the tubules, no nucleus in the glomerulus. So this is coagulative necrosis of the kidney. Okay, there's another there is no nucleus in the tubules. You can see all the tubules are pink. Some blue cells here. Okay, but they are not uniformly as a nucleus. So these are some inflammatory cells because necrosis is always associated with inflammation. So that is why some inflammatory cells can be there. But you can see there is no nucleus in the tubules, no nucleus overall in the glomerulus. So this is coagulative necrosis of the kidney. Now, always remember that whenever grossly we see coagulative necrosis and it's localized, then it is called as infarct. So localized necrosis is called as infarct. That is one thing that you should be very clear. Okay. Now, apart from that, look at this. This is muscle. So can you see this part of the muscle? So it is more pink in color, So this is normal muscle where you can see the nucleus. But look at this part of the muscle. It's very, very pink and there's no nucleus. In between these cells are just inflammatory cells, but there are no nucleus inside the individual muscle. So this is coagulative necrosis of muscle. Please remember, coagulative necrosis of muscle is called as Zenker's degeneration. So Zenker's degeneration is typically seen in patients with typhoid. And this Zenker's degeneration usually involves rectus muscles and diaphragm. Okay, so this typically involves rectus muscles and diaphragm. That is where this coagulative necrosis of muscle is typically seen. So this is seen in typhoid. This is very rare now, but you remember the term. So coagulative necrosis of muscle is specifically called as Zenker's degeneration, and it usually occurs in diaphragm and rectus muscles. Okay. And this is what is infarct. So I told you localized necrosis. Okay. So whenever we have localized necrosis, that is called as infarct. So you see when it is wedge shaped like this, so this is basically your dry white infarct. Okay. So this is basically your white infarct. So coagulative necrosis of the kidney localized is called as infarct. And it is appearing white because it usually occurs because of decreased blood supply to the kidney. Okay, kidney has single blood supply. So when something blocks that, it causes coagulative necrosis of the kidney. So this is what is called as infarct. So look at this. Here, complete dissolution of tissue of the brain. And what you see is you don't see the outlines. It's completely dissoluted. You just see inflammatory cells. It's like pus. This is liquefactive necrosis of the brain. Liquefactive necrosis of the brain is very typically seen. Liquefactive necrosis is typical whenever brain undergoes death. It is usually liquefactive necrosis. So that is liquefactive necrosis, which you can see in brain. Okay. Now, once we are very, very clear with this, next you should understand is the term called gangrene. So whenever necrosis is associated with putrefaction, it is called as gangrene. So whenever there is necrosis with putrefaction, okay, so this is called gangrene. So we can have two types of gangrene, okay, dry gangrene and wet gangrene. So what is the difference? The difference is that the outlines are very well demarcated in dry gangrene because there is no edema. So since there is no edema, the outlines are very well demarked. Whereas in wet infarct, the outlines are not well defined because there is a lot of edema. So it is said that dry gangrene is actually a coagulative necrosis. So the outline remains intact. Wet gangrene is basically liquefactive necrosis. So there is a lot of enzymatic action which causes a lot of damage and that causes edema. So liquefactive necrosis is also seen in wet gangrene. Okay, whereas coagulative necrosis is usually commonly seen in dry gangrene. And of course, the outlines are very well defined in dry gangrene, whereas they're not well defined in wet gangrene. So look at this. So there is a well demarcation between normal and abnormal. So this is dry gangrene. Whereas look at this. This is intestine. You can't see the demarcation of normal and abnormal because intestine has a lot of enzymes. So it undergoes liquefactive necrosis. So that is why wet gangrene is seen in intestine and dry gangrene is usually seen in your peripheries usually. So wet gangrene in intestine because there are a lot of enzymes and a lot of microbes. So that is why wet gangrene is a dangerous thing which occurs in the intestine. So that should be very, very clear to everybody, right? So that's about gangrene. Now let's study about more modifications of necrosis. One is called as caseous necrosis. What is caseous necrosis? So you have to understand caseous necrosis is basically whenever a tissue is attacked by an organism, okay, so this organism has lot of lipid in its wall, okay, like mycobacteria. So if I'm talking about mycobacteria, it has a lot of mycolic acid in the wall. So what happens when this attacks a tissue, this tissue, the lipid will be deposited. So in this tissue, the lipid will be deposited and that is what is called as, so this tissue will appear very cheesy. So this is what is called as caseous necrosis. So whenever the mycobacteria attacks any tissue, it leads to caseous necrosis. So it appears very cheesy grossly. And microscopically, cheese, how does the cheese appear? It is amorphous. It means it doesn't have any morphology. It's amorphous. Granular, pink deposits. Okay, so amorphous granular pink deposits is seen in microscopy. And if you look at this, okay, so because it's TB, so there will be a lot of giant cells which will be seen here. So in the periphery, you will be able to see a lot of Langhorne giant cells. So you will be able to see a lot of Langhorne giant cells. So whenever you're seeing a lot of Langhorne giant cells, so that is another clue that there is tuberculosis. So is caseous necrosis unique to TB? No. It is very characteristic of tuberculosis, but it can be seen in other conditions also. So whenever we have fungal infections, then also it can be seen. So caseous necrosis can be seen in a lot of conditions like tuberculosis, fungal infections. So you should know how to identify it. So look at this gross. So this is lung. You can see hilar lymph nodes here, which are appearing very cheesy. Apart from that, in between also, this is very cheesy. That is what is cheesy appearance in the lung. Okay, so that's very typical cheesy appearance in the lung. Okay, so this is an anthracotic lung showing you caseous necrosis. If you look at the microscopy, look at this pink color. It's like granular pink. So that granular pink appearance is very classical for caseous necrosis. So that's a classical feature of caseous necrosis, and it occurs whenever there is a lot of lipid in the wall of the organism which is attacking a tissue. So that is caseous necrosis. Now, in contrast to caseous necrosis, we have two site-specific necrosis that we should be very clear. One is called fat necrosis, and the other is called fibrinoid necrosis. So remember, fat necrosis occur whenever the fatty tissue dies. So how does fatty tissue dies? Because of two things. Either they undergo trauma. So fatty tissues like breast, buttocks, omentum, or there are dedicated enzymes like lipases which will break the fat into free fatty acids. So this free fatty acid will combine with calcium. This free fatty acid will combine with calcium, and this gives a very characteristic appearance. So this free fatty acids with calcium will form soaps. So that's a very characteristic feature here. Okay, because this reaction is called as saponification. What is this reaction called as? Saponification. So it will lead to soaps. So how does this soap appear? So it will not be like you will be getting Palmolive soap or you will get Lux soap. It will be like a chalky white deposits. Okay, so tell you a very classical case. Okay, in earlier days, we didn't used to do true cut biopsy. So they used to do the mastectomy directly after mammography. So in mammography, there was a strong suspicion. There was a lump, strong suspicion of cancer. Mammography was done. They said cancer. At that time, true cut biopsies were not there. So mastectomy specimen came to us, and there was just these chalky white deposits. There was no cancer. So that is how it massacrates. So after that, now it is a rule that we have to do true cut biopsy in the breast. We cannot do mastectomy like that. Okay. So remember, that's how fat necrosis appear. So trauma to the breast can lead to formation of lump because of these chalky white deposits. That's how we catch them. Or patients with pancreatitis, acute pancreatitis. Also, there's a lot of lipases which are released. So that can also lead to formation of chalky white deposits. So that's classical fat necrosis, which you have to know. Okay. So let's look at fat necrosis. So look at this. So this is a fatty tissue and you're seeing these chalky white areas. So whenever you see these chalky white areas in the fat, that's a typical clue for fat necrosis. Or in pancreas, you see these chalky white areas. So very classical of fat necrosis. Okay. In contrast to this, what is fibrinoid necrosis? So name itself says fibrinoid, something like fibrin. So this occurs in the blood vessels. So whenever we have two things can happen. Either we have antigen-antibody reaction, which can deposit in the vessel wall. So whenever these antigen antibodies can deposit in the vessel wall, they can cause endothelial damage. They can cause death of the endothelium. So when the endothelium dies, obviously the coagulation proteins which are in the blood, they can also come and line the vessel wall. So they'll come and line the vessel wall. So the vessel wall will appear very pink in color. Okay, why it is dirty pink? Because there is a lot of inflammatory cells, because it's death. So inflammatory cells will be there. Along with that, there is a lot of immune complexes which are there. So main culprit here is the immune complexes, which has damaged the endothelium. So these immune complexes, inflammatory cells, and the coagulation proteins total together give that pink color. So that is what is called fibrinoid necrosis. So immune complexes that can deposit in the vessel are: number 1, polyarteritis nodosa. So whenever we have polyarteritis nodosa, immune complexes can deposit in the vessel wall and cause fibrinoid necrosis. The second thing that can happen is malignant hypertension. When the BP is so high that it directly causes necrosis of the endothelial cells die. So there has to be death of somebody. Who dies? Endothelial cells. So when they die, so these again coagulation proteins come out and they line the vessel wall. So these causes like malignant hypertension, polyarteritis nodosa, or Aschoff's nodule. In Aschoff's nodule also there is immune complex which damages the endothelium. So these typically cause fibrinoid necrosis. So fibrinoid necrosis is typically seen in polyarteritis nodosa, Aschoff's nodule, and malignant hypertension. That is what you should be very clear with. Okay, so that is your fibrinoid necrosis, which you should be super clear with, right? So look at this. So this is the blood vessel. So there is loss of the endothelium. So blood vessel is lined by pink color material, but it's dirty pink. There are a lot of blue debris here that are neutrophils. So that's very classical of fibrinoid necrosis that you should be very clear. So to recap, if we make a box, okay, to recap, to see what all can be asked to us. So what all type of necrosis have you studied? So is everybody clear? Most common type of necrosis is coagulative necrosis. This is the most common type of necrosis, and the appearances that they can ask you: glassy appearance, moth-eaten appearance, and why do they appear pink, which we have discussed. Okay. Second, liquefactive necrosis. Do you remember liquefactive necrosis? Again, it is mostly seen in brain. Also, don't forget, wet gangrene is also liquefactive necrosis. So there is enzymatic degradation. Now, third, caseous necrosis. All of you have studied caseous necrosis is usually seen in tuberculosis. And you already know this occurs because there is more lipid in the wall of the organism. So mycolic acid is the culprit in TB. Then you have already studied Zenker's degeneration, which is actually coagulative necrosis of the muscle. Then you have already studied, again, fibrinoid necrosis. So fibrinoid necrosis occurs because of the immune complexes which are deposited in the vessel wall. So that causes pink deposition around the vessel. So polyarteritis nodosa, malignant hypertension, or Aschoff's nodule. All this causes fibrinoid necrosis. Then next you have studied about fat necrosis. So fat necrosis typically occurs either in the trauma to the fatty tissues, or it can occur in pancreatitis. And you've studied that it causes formation of chalky white deposits. That's a catch point here. Then you have studied gangrene. Okay, so which can be dry or wet. Wet gangrene is coagulative necrosis. Dry gangrene is coagulative necrosis. Wet gangrene is liquefactive necrosis. So these are typical necrosis which you should be very clear, and they are stat questions that can be asked from this. Okay. Now let's understand the difference between necrosis and apoptosis, right? So before knowing the difference between necrosis and apoptosis, there's one more point you have to know. See, we have studied reversible, irreversible injury, necrosis. See, the characteristic feature of these are irreversible injury and necrosis is membrane damage. So whenever the membranes are damaged, the enzymes from inside the cell comes out in the blood. So this is a very important clinical effect which you should remember. That is why when the cardiac membranes are damaged, troponins, TROP-T and TROP-I comes in the blood within 2 hours of damage to the membranes. Or similarly, when the person has hepatitis, so these transaminases come out from the liver and it gives you a diagnostic marker that patient has got hepatitis. So that is one beautiful chart from Robbins which says that duration of injury and effect can be correlated. So once your cell function is lost, that's reversible. But once the irreversibility starts, membrane damage occurs, the biochemical enzymes come into the blood. After that, you will be seeing a lot of ultrastructural changes, light microscopic changes, and the cross changes at the last. So that's the order which everybody should know and can be asked. Okay, so that is why the biochemical markers which come in the blood, like troponins, like your viral transaminases or alkaline phosphatase in bile duct injuries, all these are considered as very important markers of injury, and they help in diagnosis of necrosis. So that is what. So myocardial infarction is damage to the membranes of the heart. So that is why troponins come in the blood within 2 hours. So that is what you should know. That's a advantage of membrane damage, which helps us in diagnosis, right? So once we're clear with this, now let's come to the difference between the necrosis and the apoptosis, right, guys?